Welcome back. Now, some counties have announced special allowances for their healthcare workers, including Machakos and Mandera. Machakos in particular asking for a special allowance of between 5,000 and 20,000 a month for the period of time during which we are fighting the COVID-19. But the SRC has called these unlawful to offer special allowances without its advice. And the COG has said the incentives are key motivators and that they've been guided by regulations of their respective public service boards. But the SRC says not so fast. Lyn Mengich, who's the chair of the Salaries and Remunerations Commission, joins me live now. Madam Chair, thank you for speaking with me here tonight on Citizen Television. So tell us why you disagree with the move by counties to provide special allowances for their healthcare workers at this time.
Yvonne, the Commission does not object to allowances being considered as one of the measures to address the issues raised by the health workers. Indeed, we do appreciate the role played by the health workers. We know that they are doing a lot, they are sacrificing. They are our heroes at this point in time. What the Commission does not support is uncoordinated effort that leads to different institutions taking different measures. And where we are at the moment is that we have, as you rightly said, two counties who have gone ahead to pay. So what happens to the others? What it does create, and this is what the Commission is concerned about, is it creates a situation of fairness and inequity in the way the response is made. We are advocating for a coordinated response that allows all employing institutions to take measures that are coordinated so that there is fairness, there is equity, and it is affordable to the country.
So what would your advice constitute, specifically, if they were to come to you and say, this is something that they're considering doing for the healthcare workers?
What the Commission will be looking at is constitutional principles. We do have 5 principles in the Constitution in determining remuneration and benefits for all public officers. 2 of these principles will be very key when we get submissions from the employing entities. The first one is the principle of equity. That requires that when this is addressed, all the health workers who are indeed fighting this pandemic are brought into the picture, so that we are not just addressing one cadre and we are forgetting others. Indeed, if you look at this fight on the pandemic, we do have health workers, we have doctors, nurses, we also have those who are testing the COVID, we also have the clinical officers. So indeed, what we'll be looking at is equity. Have we addressed every individual frontline worker who is fighting the pandemic? And it actually went beyond just the health workers. There are all the other employees who are also key in this role. So the principle of equity is to ensure that the issue is looked at in a more holistic manner, that we address all the workers who are indeed fighting this pandemic, and we don't end up with a situation of unfairness or inequity in the response.
Okay.
The second principle, let me explain the second principle because it is very critical. Is one of affordability and sustainability. At this point in time, we do know that there are limited resources, and there is need to respond in such a way that as we look at the critical areas in fighting this pandemic, specifically we are looking at the healthcare, we're looking at equipment, and indeed we are looking at livelihood, especially for the vulnerable members in our communities. So the issue about resourcing is so critical that there has to be a discussion on how much resources is available and what can be allocated to which area and what are the priorities. When you have institutions going it alone, it denies that conversation about affordability and sustainability going forward.
Okay, but some would say the Constitution gives the SRC mere advisory over matters to do with public servants, and that the county governments were well within their rights to then make this decision on their own.
Well, the Constitution in Article 230 clearly states that the Commission has a mandate to advise both the county and national government insofar as remuneration and benefits. The word advisory is interpreted in the Constitution itself, and it is indeed binding. When the Commission advises, it is binding upon those institutions. It is not advice for the sake of advice. So going ahead to make any payments without the advisory of the Constitution is unlawful. And what we have said repeatedly is the law is still in force. Even in the time of pandemic, we must still adhere to the law. And there is a reason why we must follow the law even in such times as this.
Okay, I have a question from Mwachonda Chibanzi, who's the Acting Secretary General for the Medical Practitioners Union. He asks whether SRC recognizes Section C23 of the PSC HR Policy 2016 on allowances, considering circumstances like we're in COVID-19. And that section states that government may pay other allowances to different categories of public officers in various circumstances, COVID-19 perhaps being one of them, saying such allowances shall be determined and communicated from time to time. And so they're asking what your thoughts are on that, considering that this can be done in these special circumstances.
That clause that he has stated, it does say that it shall be advised by the government from time to time. Government in that respect is actually the Salaries and Remuneration Commission. So the clause he's talking about does not in any way contradict the mandate of the Constitution. And the fact that there is a pandemic does not mean that you cannot follow the law and that you cannot seek the advice, and that upfront to state that any institution can just go ahead. I have mentioned where we are at the moment. There is unfairness, there is inequity. And we haven't addressed the issue about affordability. Those are very, very critical issues that must be discussed so that the response is coordinated and we have all these issues addressed.
So what now? What next? If the counties, go ahead and say this is something they're doing, these are extraordinary circumstances, they're going to do everything to keep the health workers motivated. So what's your next move as SRC?
Yvonne, as we speak, we do know that there is no county with a budget to fight the COVID-19 because indeed nobody has a budget for it. It wasn't budgeted for. For any allocation to be made, there has to be a conversation with the relevant institutions of government on where this will be funded from. So critically, much as the counties may say, I want to go my way, they know that they don't have the budget for it. And that's why we are asking that there's got to be a process so that that discussion is done centrally, and there is a discussion around where will these funds come from, how much can be actually allocated for these measures that is being advocated for.
Lyn Mengich, Chair of the Salaries and Remunerations Commission, thank you very much for speaking with me here on the program tonight. We'll indeed see what happens going next. We want to take another quick break here on the program tonight. When we return, we have some good news from the world of sports, some recoveries that have been reported there from some players in the club of Juventus. We'll be right back with that.